Care for allowing me to present today. As Phil said, I'm a type 1 diabetic, so this is a topic that I'm extremely passionate about, and am fortunate that my professional job just so happens to allow me to work in the field of diabetes. So thanks again, and welcome to you all who are joining us virtually as well. Phil, if you want to take. I'll give just a little bit about Telligen and who we are, why we're working in the area of diabetes. So all states in the U.S. have a Quality Innovation Network and Quality Improvement Organization, or QINQIO, as I'll call it from here forward, that's contracted with the Centers for Medicare and Medicaid Services, or CMS, for healthcare quality improvement. Telligen was awarded the QINQIO contract for the states of Colorado, Iowa, and Illinois. And if you are familiar with the Colorado Foundation for Medical Care et al., or CFMC, Telligen acquired a majority of their healthcare quality improvement contracts that were held by CFMC in the past. So another thing that I like to point out under the green check mark there under the slide is that we are the resource arm of CMS, or of Medicare. On the right side, a few things that we're not the regulatory arm, we're not surveyors or auditors for Medicare, and we're not the reimbursement arm of Medicare. So we get to do a lot of the work that I consider fun with Medicare, because we're working with local communities and providers. So another thing is that if any of you are familiar with the QIOs being the ones to review patient discharge appeals for home health, skilled nursing facilities, and hospitals, we no longer do that work. It's now done by an organization called KEPRO for our Colorado region. Medicare recognized that it's not great for us to have both of those contracts, reviewing charts and reviewing appeals, and also working on the healthcare quality improvement side, so they've split those two contracts out. The QINQIO program purpose is to improve the efficiency, effectiveness, economy, and quality services delivered to Medicare and Medicare/Medicaid beneficiaries through performance-based contracts, and our results are measured by Medicare. QINQIOs help achieve national quality goals through focused efforts at the community level. So what brings me here today is that one of our Telligen tasks is called Everyone with Diabetes Counts. In this work, we aim to help bring diabetes education to areas of Colorado that are underserved with this education. According to the Center for Disease Control statistics, in 2010, only 57% of people 18 years and older that had been diagnosed with diabetes had attended a diabetes self-management class. And just in general, if you want to know more about the QINQIO program, you can refer to the website at the bottom of the slide. So I'll stop boring you with the details about Telligen. Let's get into what we want to learn out of the presentation today. The first thing is to really understand the definition of prediabetes and diabetes and how common they are in the US and in Colorado. The second objective is to understand the basics of 3 types of diabetes education opportunities in Colorado. Those 3 being clinical-based education, sometimes referred to as DSMT, community-based education, or DSME, and the diabetes prevention program, and to recognize some of the unique characteristics of each of those programs. And then lastly, to be able to identify resources for locating these programs in Colorado. So a few things, and many of you may very well be familiar with these, but I always like to do just a general overview, a few things that diabetes is. On the left side of the slide there, some of the facts about diabetes. It is a disease where blood glucose levels are above normal. And most of the food that we eat is turned into glucose or sugar for our bodies to use for energy. An organ that lies near the stomach, the pancreas, makes a hormone called insulin to help glucose get into the cells of our bodies. When you have diabetes, your body either doesn't make enough insulin or can't use its own insulin as well as it should. This causes sugar to build up in the blood. A range of emotional responses to diabetes is common, including depression, feeling overwhelmed, and feeling isolated. The good news is diabetes can be managed, and it's a common condition. We'll see more about that in a minute. So on the right side of the screen, under myths, a few things that diabetes is not. When managed properly, complications such as blindness, amputation, and kidney damage can be delayed or avoided. People with diabetes don't have to stop eating their favorite foods altogether. The key is knowing how much sugar is in your food and making wise choices about timing and portion sizes. And last, people with diabetes can definitely still enjoy the activities and hobbies that they're used to. The key is to time the activity right and keep the needed medications, snacks, glucometers, and other supplies close at hand. All right, so trivia time. For those of you who are remote, feel free to use your chat function, and Phil will help us monitor that. The first question, from 1980 to 2011, the number of people with diabetes has more than what? Quadrupled, doubled, or tripled? Guesses from anyone?
I'm going to cue the music here, guys.
Jeopardy music. All right. So according to the Center for Disease Control and the National Institutes of Health, the number of people with diabetes has more than tripled in those years. In 2011, over 20 million people knew they had diabetes. In 3 short years, that number grew another 9 million people. Which leads to our next trivia question. Although more than 29 million people now have diabetes, how many of these people don't know they have it? 2 million, 8 million, or 4 million? Give just a few seconds through the chat. Give us your best guess. Must be time for coffee. All right. Of those 29 million people, 8 million don't know that they have diabetes. So on the next slide, if we look at the 2012 map of the US, the lighter shade of blue, the lower the rate of diabetes. So you can see Colorado is highlighted there in yellow. In Colorado, 9 of every 100 adults knows they have a diabetes diagnosis. In comparison, we'll look at Mississippi, who has the highest rate in the US at 12 people per 100 with diabetes. So the good news is you can see that Colorado is one of the lowest states in the nation for the rate of diabetes per 100 people. Let's take another second on chat. Is there anything on this map that is surprising to anyone or anything particular that stands out to you? Looks like we've got a few people drafting something up. We'll wait here for a few responses. All right, Cheryl, heavy in the southern states, especially, absolutely. Would not have thought the numbers in California would be so high. California is higher than I would have thought. A question from Cheryl, due to diet, that's absolutely part of it. Activity would be another thing. Genetics plays into it, so there are a lot of things that play into that. But it looks like we need to extend our reach out into California. I guess good news is we do have a peer organization out there working on the same initiative that we are. So on the next slide, when I think of diabetes education, I really think of three major buckets as designated by the different colors here on the slide. The first type is what you see in the green area, which we'll refer to as the Diabetes Prevention Program. And this is designed for those who are at a high risk of developing diabetes, which is a condition referred to as prediabetes. In a minute, I'll show you a tool that can be used widely to help determine if you or others might be at risk for developing diabetes. So under that green area, you'll see that the Diabetes Prevention Program classes can be in a hospital, a clinic, or a community setting. There are a lot in Colorado. There are a lot of YMCAs that provide this programming. The second bullet point is that it does require a referral from a healthcare provider. Some insurances will cover DPP, but there may be an out-of-pocket charge for the program. It is a year-long program that runs weekly for 6 months and then monthly for 6 months. And the people going through this education have a personal healthcare coach that they work with, and it takes place in group classes. The second type of education is what we'll refer to as Diabetes Self-Management Education, or DSME. Under the blue section there, these classes are often held in the community. So you might see them in churches, in senior community centers, libraries. So they're really community-based. Although there are some providers in Colorado that will offer this in their office, it's more standard that it's offered in the community. These classes don't require a referral from a healthcare provider, and a majority of the classes are at no charge to the individuals who are going through the education. And basically, one DSME workshop is 6 weekly sessions, and these again are group classes. And then the last type of education that we'll talk about in detail today is in the orange category there, and that's Diabetes Self-Management Training, or DSMT. So here, these classes are most often in hospitals or physicians' offices. They also require referrals from healthcare providers. Most insurances will require a patient copay. The structure of this is that the first year of education, they can provide 10 hours per year or 2 hours each follow-up year. And then the last thing is that these can happen in group or one-on-one classes. So if you can, well, let's take a second here. It looks like we might have a few questions. Cheryl is asking, I sat in on a community free class for diabetes called Cooking Matters. It was wonderful. Are you familiar with their program, and have you seen positive feedback or others? Cheryl, that's not a program that I'm specifically familiar with, but these programs, a lot of them, depending on the organization who's providing the education, they'll come up with kind of their own tagline for the education, so that could very well be one that I'm not familiar with. All right, so in the chat function, are there any of you that are joining today that have undergone any type of these educational classes, or know someone who have, other than Cheryl? We saw that she's been through this. Anyone else have personal experience with any of these? All right. So basically, one thing that I would share as a type 1 diabetic myself is that when I was first diagnosed, I was sent through DSMT, which falls in that orange category again, that's clinically based. And that was when I was first diagnosed, and after 18 years, I had never been offered any other type of education. I was fortunate enough to go through one of the DSME classes the end of last year, and I can't tell you the number of things that I learned through that class, even after 18 years of being diabetic. So I just strongly encourage people that even if they've attended one program, to not eliminate the possibility of attending other programs. They're all very highly complementary and offer kind of different takes on things. All right, so we'll stay with the color coding theme here as we move on through the next slides with diving into the diabetes prevention program a little bit deeper. This diabetes prevention program is a lifestyle intervention based on research funded by the National Institutes on Health. And a few things that this study showed for people with prediabetes is that there was a 58% reduction in the number of new cases of diabetes within all age groups that attended DPP. There was a 71% reduction in new cases of diabetes for those over age 60. And this was achieved by learning how to reduce calories, increase physical activity, and a weight loss of only 5 to 7% of a person's body weight. On the next slide, a few things that are taught in DPP. Basically, the goal for each participant here is to lose greater than or equal to 5% of their body weight. And they do this by reducing dietary intake of calories and fat through improved food choices by taking small steps over time, by gradually increasing moderate physical activity, and lastly, by developing behavioral problem solving and coping skills. The next slide is just a visual indicator of where the DPP programs are located in Colorado. So you can see there's a pretty wide availability throughout the state. We'll always see a pretty heavy penetration in the metro area, but even outside of that, we've got some opportunity with programs in the outlying areas. The next slide. So this is the tool I mentioned earlier that can be used to assess the risk of developing diabetes or having prediabetes. Just a quick poll through chat. Have any of you seen or used this tool before? Doesn't look like it right now. Okay, so I actually have a few copies here for those of you that are in the office. Feel free to take them, but it's also available online at the link on this slide. So if you're seeing patients and clients that don't have easy access to the internet, I'd highly recommend printing some of these copies and keeping them handy. And the second page of this screening test gives recommendations on next steps to take based on the score. I guess one important note is if you have folks that are scoring high, just encourage them to not be alarmed, that it's a good step to talk to their doctor and know that there are things that they can do to prevent diabetes. And then,
can it be used for children?
Let's see, we have another question from Cheryl. Can it be used for children? Really, this questionnaire can be used for any population. One of the questions is specifically related to age that determines risk. So this should be applicable to any age group. The next slide, if you or you know anyone that might be interested in attending DPP, again, these are for those who haven't been diagnosed with diabetes but might be at risk or have prediabetes. You can have them take the prediabetes screening test, follow the recommendations on the second page of that screening test, always ask the doctor if this is a good program for you. And then the last thing on the slide is where you can find the specific locations of those programs that we saw on the map on a previous slide.
And just so everybody knows, these links that Meredith is describing in her presentation today, we will have those out on our website after this session is completed, and it'll be under the resources tab on our website. So just want to keep that in mind. Meredith, I noticed there's one subsequent question from Cheryl. Do these programs like the DPP and what is it, DSMMT, I think, do these programs also apply to kids, or is it really just adult focused?
You know, Cheryl, I haven't seen any specific studies on children, primarily because we're contracted with Medicare, and that's where I spend a majority of my time looking at the research, but I could certainly look further into that for you. I'll follow up with you to see what we can find out. And then Melody, I see your question. Our website URL is Telligen. Let's see, www.Telligen Quin QIO, so QINQIO.com. All right. Let's move on into DSME. So on this slide, I've listed a few programs that you might see here in Colorado. A few of them, the first one is the Stanford Diabetes Self-Management Program, or DSMP. This is the curriculum that a lot of the DSME programs offer. The second one is Everyone with Diabetes Counts, and that's Telligen's specific diabetes education initiative, and we're also using the Stanford curriculum from the previous bullet point. There's also a Healthier Living Colorado Diabetes. That's coming out of the Consortium for Older Adult Wellness over in Lakewood. And then there are some programs referred to as Be Well with Diabetes, Living Well with Diabetes, and that list certainly isn't all inclusive, but those are some examples. And then the first two are also part of a national initiative. So an example of that is, Telligen is contracted with Medicare, but every state and territory in the U.S. is also working on this same diabetes education initiative. On the next slide, a few things that you'll find are taught in these DSME classes are techniques to deal with the symptoms of diabetes, fatigue, pain, hyper and hypoglycemia, or high and low blood sugar, the stress, the emotional problems like depression, anger, fear, and frustration. We talk a lot about exercise, healthy eating habits, and reading food labels, and that's always very interesting and very enlightening. I feel like that's one of the exercises that the participants learn the most from, is learning more about the food labels. And we talk about the effects of medication, how to work more effectively with healthcare providers, and then the last piece, which is so big, is making weekly action plans. And these aren't big action plans, these are just small, actionable steps that the participant can take to improve their diabetes management. You also share experiences and help other workshop participants solve problems that they can encounter in their own diabetes self-management. So the next map on this slide is, again, a visual representation of where DSME is in Colorado. The green dots represent English-only programs, and yellow are English and Spanish programs. So Telligen will be working to expand the availability of these programs in other areas in Colorado. If you have folks interested in attending DSME, this is appropriate for anyone who's been diagnosed with prediabetes or diabetes and is also open to caregivers, friends, and family members. This is an interactive group workshop. It's not a lecture, and that's really where we get a lot out of these classes, is that group interaction with others who also have diabetes. Again, you want to encourage individuals to talk to their doctor about this being a right fit for them. And then the last bullet point, again, are a few resources for where these classes are located in Colorado.
And it looks like if you have any questions, Sue, you can also call Meredith. You'll see that her phone number is there, and we can also include that out on the website, or we can, if you're interested, you can certainly contact any People Care office and we can get that number to you if you have any other questions that you want to ask Meredith at the completion of this presentation.
Thanks, Bill. And on the last slide, I also have my email contact information as well. All right. So to wrap up, we'll look at DSMT in Colorado. And this is really primarily one-on-one classes or interactions that patients with diabetes have with their providers. So these are licensed healthcare providers, such as certified diabetes educators. And because they have that clinical expertise and background, they can really make specific recommendations for insulin administration, insulin pump use, adjusting medication. It's really specific to the individual. In the group classes, we always steer away from providing any type of individual guidance. We always encourage them to reach out to their healthcare provider directly. So this is typically taught to the person that has diabetes and doesn't typically involve other family members or caregivers. On the next slide, as far as DSMT programs in Colorado, again, we have a pretty wide representation. And the different colored dots really represent the two different organizations or accrediting bodies for DSMT, who is the American Diabetes Association and the American Association for Diabetes Educators. So those just are different accrediting bodies, but they're all DSMT programs. So as we've looked at the three maps of Colorado and the different types of program, which do you recognize as having the least amount of dots or representation? Looks like we've got someone chiming in. All right, Melody, you specifically mentioned Southeast Colorado as a geography, and that's absolutely right, really for all types of education. And if we compare each of the three maps and look at the programs, the DSME map really has the least representation of number of programs throughout the state. And that's really what we'll be working to expand over the next 4 years. One of the reasons for that is that more insurances pay organizations for DPP and DSMT than they do for DSME. There is some grant funding that folks have gotten to provide this DSME education, but it's not widely available. But under our contract, we hope to see that change over the next 4 years so that we can get more of this education. Our Everyone with Diabetes Counts initiative aims to provide Medicare with data out of these DSME classes that helps demonstrate the great results being seen from the education. And then the last thing I'll mention is that Medicaid has actually just received approval from the General Assembly in Colorado to start reimbursing for diabetes education. And that starts in 2016. So stay tuned to your Medicaid news for more details coming about with that. If anyone is interested in attending DSMT, the two websites are directly to AADE and ADA, and they specifically list each location. So you can find where those are. They both have Colorado links, so you'll see just information specific to Colorado. All right, so if we think about these different programs and trying to determine which program might be the right fit, again, there are some times that more than one program will be a good fit, but this just goes through some questions to ask. The first one is, do I prefer individual interaction? And if so, the DSMT program would be best for that. The next is, do I need clinical guidance on how to adjust my medications, take injections, or program an insulin pump? Again, that's going to be DSMT. Do I prefer group interaction, helping others, meeting others also affected by diabetes? Those would be best served by DSME classes or DPP if they're pre-diabetic. Which programs are available in my area? Again, you can refer to the contacts on that slide. I always, again, welcome people to contact me individually. I can certainly link you into programs in your area, or if there aren't educational programs in your area, we can talk about setting that up. The next question is, have I been diagnosed with prediabetes or have a high risk of developing diabetes? And that, again, would be DSME or diabetes prevention program. And lastly, do I have a new diagnosis of diabetes? And that would be DSME and DSMT. All right. So I have a few bullet points here, but before we go through this, I would be interested to hear from anyone through chat if you have personally identified any steps that you can take or would like to take to help increase the number of people with prediabetes or diabetes that find and experience at least one of these programs. Is there anyone with us today who has identified something that they plan on doing? Looks like we've got some information being drafted here. All right, so if we look at kind of a call to action and next steps for anyone that may be affected themselves with diabetes, consider taking the class on diabetes self-management if you haven't done so already, and talk to your doctor about good options for you. Cheryl, it looks like you've chimed in. Getting the word out on these programs to our clients and care staff will be great from the presentation and information. That's great to hear. I appreciate that, and it's amazing being out in the field in Colorado how there just is a lack of knowledge that these programs exist. So given that there are so many of us with diabetes, any help we can get on spreading the word is truly appreciated. Another thing, if you're affected by diabetes, is to find a friend or family member to attend a diabetes education class with you. That's one of the things that we hear in our classes. You know, sometimes we'll have a spouse of a husband with diabetes, and she's the one that does all the cooking. So really, she gets just as much benefit out of the class as the person with diabetes. The next slide is if you're case managers and caregivers, first of all, definitely know if your patients and clients have diabetes. If they don't have diabetes, are they at risk? Maybe help them take the pre-diabetes screening test. Encourage them to speak with their case manager and doctor about attending a diabetes education class. Let them know that diabetes is common and that they're not alone. There are resources for helping them manage. Another opportunity is to consider attending a DSME class yourself. It will help you understand your patients and clients that are living with diabetes, and to share this presentation with others. And I would also add that although in these slides I mentioned talking to your physician, physicians and providers, again, aren't always aware that these programs exist. So if you have patients being discouraged that they've asked their doctor and the doctor's not aware of these opportunities, feel free to reach out to me with that, and we'll see what we can do to help them.
Meredith, what do you think the biggest challenge is for somebody that's maybe pre-diabetic or maybe newly diagnosed, whether it's type 1 or type 2 diabetes? What do you see as their biggest challenge?
The things that I've heard up to this point are certainly that sense of overwhelm. I just spoke with a lady earlier in the week who her daughter had gone with her to the doctor's appointment, and she was receiving her diagnosis of prediabetes, and she said immediately her and her daughter just started crying because she was having visions in her mind of not being able to see her grandchildren and interact with the grandchildren. And there's always been such a fear-based message around diabetes that if you don't take care of yourself, you're going to lose a limb, your kidneys are going to go bad, you're going to go blind, that I think a lot of people are really overwhelmed initially to get that diagnosis. So that's where I just really encourage people to provide some emotional support around the diagnosis.
You know, People Care is a rural-based home care provider. What is it that, I know your focus has been trying to get the word out into these rural communities. Mm-hmm. What types of activities do you see creating that kind of momentum for some of these rural communities in Colorado?
A big one for us has been the senior centers. The meet and eat is what they call it. Those folks are together every day eating meals. The messaging for me in rural communities is really that those folks like to help their neighbors, and they all know each other. And so if we can make diabetes a community issue to where the community really starts to have an understanding of what diabetes is, that gives folks living in those communities the opportunity to help their neighbors. Some people shy away from it because they don't know how to help. That's one of the big things that I found in the rural areas, and I really just go out to those communities. Akron is a community that I'm working in currently in eastern Colorado. Just get out of the car and start walking down the street and telling folks about this education. So it's a grassroots effort that I think over the next 4 years it's got some opportunity to gain some traction.
Do you find the medical community in some of these rural areas, are they lacking in the same education, where these people are, say they're diagnosed with diabetes, they have to come into maybe some of the more highly density areas to get the resources that they need, or do you think they're becoming more educated? What's your thoughts on that?
Well, in my conversations, I'll use Akron again as an example. I was speaking with the health department out there, and she stated that our Medicaid expansion in Colorado has really provided some challenges because the folks in Akron were typically going out to Yuma County or Morgan County to get more services. And now with expansion and that increased volume of patients, a lot of those clinics just don't have the capacity to see folks. So that's definitely a challenge that they're up against. And they've been just really grateful to have conversations with me. They said we don't have a lot of consistent opportunities for this. People come in and go, and they're encouraged by the fact that, you know, over the next 4 years that we can look at some long-term educational opportunities.
That's good. That's good.
Is there anyone out there with questions? Feel free to use the chat function again to send in any other questions that you might have. The other thing that I can say briefly in closing is that we're, in addition to providing this DSME education ourselves in these communities, we're very interested in finding trainers who would like to learn how to become trained to do this education. For DSME specifically in the Stanford DSMP program, there aren't requirements or prerequisites. You don't have to be a nurse by training. In fact, a lot of times they like to have folks from those communities that are peer educators lead the classes. So if you know of anyone who might be interested in becoming a trainer to lead these classes, definitely reach out to me through one of the methods here on the last screen, and I would be very willing to have a conversation with you about that.
And again, we'll put Meredith's contact information out on our website. It'll be under the Education and Resources tab on the website, and that should be uploaded. This presentation should be uploaded probably within the next 48 hours, so you can find it out there if you'd like to share this link with some of your staff members or team members. We welcome that opportunity as well as Meredith would, I'm sure, and encourage you to, any of you, to reach out there. Any closing comments, Meredith?
I think we've covered it very well. I just want to thank you all for your time today, and thank you for everything that you do to help our individuals in Colorado, whether they have diabetes or not. The work that you do is so very important. So thank you for that, and have a great afternoon.
Yeah, and we want to thank everybody from People Care Health Services. We want to thank you for attending this meeting with Meredith. And next month we'll be discussing psychopharmacology, and you'll be seeing a link come out to those of you that were attending this meeting as well as anybody else. Certainly encourage you to be on that one. That'll be July 8th at 1 o'clock here on this same format. Thanks again, Meredith. Thank you, and have a great afternoon, everyone.